So welcome everybody to our Healthcare Communication Tools webinar featuring our self-advocates um, entitled, This is About My Health, Tools to Help You Stay Healthy. So my name is Irfan Jiwa. I'm a research analyst and physician. I'm working at the Azrieli Adult Neurodevelopmental Center, and I will be facilitating our event today together with our two amazing self-advocates, Elsa Spreiselberger and Victor Pereira. You guys want to take a minute to say a few things about yourself?
Hi, I'm Victor Pereira. I'm a research analyst at CAMH, and it's been a wonderful time at CAMH. I cannot stress this enough. Irfan is the best, and he understands everybody's needs, and he's just a wonderful guy. Erica has been a wonderful presenter, and she's always kind, always upbeat, and we're gonna have fun today. And if you're joining us from all around the world, thank you for taking your time just to be listening to our little spiel. And everybody is amazing.
Perfect. Erica, do you want to say a few words about yourself? Thanks, Victor.
I'm Erica. I am a self-advocate at CAMH. I got involved doing the research with CAMH when I had presented my an article that I had written for my school about mental health. I had read that at their One Brave Night, and it was a real hit. And I also, not only do I do the research at CAMH, but I also had started my own Instagram page for mental health. And there I just kind of share my story and just some tips and tricks. So
shout out your Instagram page. Shout it out.
It's called, my Instagram page is called Free Your Mind Mental Health. And
it's really good.
It's real, yeah.
It's really good. Trust me. I'm an advocate, so I know what I'm talking about. It's really good. You should follow it. If you're not following it now, you should.
Okay. So thanks for introducing yourself, guys. We'll get started. So just to start off, I'm just going to let everybody know what the tools are, and then we'll move to the panel section where I'll be asking Victor and Erica some questions about the tools so we can all understand the tools a little bit better. So to start out, why use healthcare communication tools? I think in today's world, now more importantly than ever before, tools are going to be very important when we visit healthcare providers, especially in the current times with COVID-19 and the pandemic. A lot of people are now starting to visit their doctors virtually. And so tools can be very helpful in terms of making those visits go a little bit better, where you can use tools to facilitate communication, send some information ahead of time to your healthcare providers, to your doctors, so that they are better prepared, so that you're better prepared for the visit and they're better prepared for the visit, and the visit goes really, really well. We actually put together a video that is now on YouTube, which shows how a virtual visit could work and can help you learn how to set that up. So we'll be sharing a link after this event, which has the link for the YouTube video on how to have a virtual visit with your doctor. Just running into the tools, we're going to be talking about 3 different tools today: About My Health, My Healthcare Visit, and a sort of newer tool, which is the COVID-19 hospital transfer form. So I'm going to start out with giving us a bit of an overview of the 2 tools, the main tools: About My Health, My Healthcare Visit. Then we'll move into a panel discussion with our self-advocates. And then there'll be a chance for our audience to ask questions to our panelists about the tools. And then we'll wrap up talking a little bit about the COVID-19 hospital transfer. Okay. So the first tool that I'm going to quickly touch on is called About My Health. This is a tool that is very useful when you're seeing a physician or doctor, a healthcare provider for the first time. It helps to convey information about yourself and who you are. So like you can see, this is the sort of the first page of the tool that I have on the slide here. Some identifying information about your name, where you live, what your living situation is, a little bit about your interests, what you like to do, important people in your life. Sometimes mentioning some difficult life experiences is relevant so that the doctor knows about those things ahead of time. And important contacts or people who are important to you in terms of making healthcare decisions or in the case of an emergency. Going further into the tools, there's sections talking about what your medical history is like, any previous diagnoses you have, any allergies you have, as well as some other important contacts like your family doctor, your pharmacy, and information about the medications that you're taking. And then this is a really interesting part about the tool, where there's some different sections on here which let you share how you would feel or how you would show if you're feeling any of these feelings here. So things like being scared, nervous, uncomfortable, in pain. Different people, especially people with developmental disabilities or intellectual disabilities, will experience and show these emotions in different ways. So this is a chance for you to share how you show those different emotions, and what are things that help when you're experiencing those emotions that are specific and particular to you. So the doctor or whoever it is, your healthcare provider, has a really good sense of how they can best help you. And then towards the latter part of this tool, there's a bunch of different strategies that help with communication or help with difficult procedures that you can sort of go through and see if there are certain things that are helpful for you. You can communicate those to the doctor ahead of time, as well as at the bottom, there's things that you like about healthcare visits and things that you don't like about healthcare visits. So by sharing some of this information, you can almost prep yourself of like, okay, what are the things that work really well, and what are the things that don't work really well? And if everybody knows that ahead of time, everybody can try to make the visit go much better because they know what are the things that we can do to make visits go better. Okay, so that's all about My Health. The next tool that we have is called My Healthcare Visit. This is a tool that you'd use at every time you'd be going for any healthcare visit, so whether this is a new provider or not. And this tool essentially is a bit of a shorter tool. The main focus of this tool is the reason that you're going to have your visit. So those are things like, I'm not feeling too well, I have a runny nose, my stomach hurts, I need more medications. There's different reasons you'd be going to see your physician or your healthcare provider. And so this gives you a chance to sort of write up some information ahead of time to convey why you need to have this visit. And then on the back side of this tool, and then some further, sorry, just before we go to the back side of the tool, there's some relevant areas that are here on the left that I'm pointing out with my mouse right now. So things like pain, eating, bathroom issues, energy issues, and so on and so forth in this list. These are a list of problems that are identified through research that tend to be common problems for people with intellectual and developmental disabilities. This is a chance for you to flag if any of these are a concern for this particular visit, and then you can provide some more detailed information about those things. And so that's the one side of the tool that you fill out before going for your visit. And then at the visit, the physician or whoever it is that you're visiting will fill out the top box saying what you talked about at the visit and what next steps are. So the plan for whatever issue it is that you are going to see your doctor, what the plan is. So things like, I need to book an appointment with a specialist. I need to do this blood work, I need to get these scans done, as well as any changes to medications or new medications. And a couple of reminders again on this tool about things to do, like scheduling any appointments or referrals. So that's a brief overview of the tools themselves. There are examples of the tools filled in online. And again, we're going to be sharing links of the two tools as well as the examples with all of the people attending. We're going to be emailing these to you. And so that was a quick overview of the tools themselves. But now I want to sort of turn over to our self-advocates and have a little bit of a discussion with them and let them tell you a little bit more about the tools. So I'm going to stop sharing screens now. And Victor and Erica, now some questions for you. So if you want to unmute yourselves. The first question that I have for you guys is, why do you think that the tools are important? Erica, you want to start us off maybe?
Sure. I think that the tools are important because it can help those with disabilities, but also it can help those who can't verbally talk.
Mm-hmm.
I think that it's a good way for them to get what they need to say to the doctors in more of a written way rather than speaking.
Mm-hmm.
I know for me and my experience when I go to the doctors, a lot of times I think before I go, if I don't use the tools, a lot of times I think before I go, okay, so this is what I'm going to talk about. This is what I'm going to need to say. And then I get there
Mm-hmm.
and go through my whole entire visit, but I forget half the time what I really went there for or what I really need to say.
Mm-hmm.
So then I end up thinking, oh my gosh, now I got to make another appointment, or I need to get what I need to say out to my doctor. Um, so it's a really good way, like I said, just to get what you need to say out,
Mm-hmm.
because a lot of times we tend to forget what we need to say. So yeah.
So like you're saying, it gives you a good reminder, I guess, and makes you stay on track in terms of the things that you need to say so you don't forget to say certain things.
Yeah, it's like a good prompt. When
It's a prompt. Nice. Yeah.
you're writing a paper and you can't really think about what you need to say.
Mm-hmm.
So it's just kind of something to give you like that. Oh, right. I went to the doctors and I need to say this. Okay. So
Mm-hmm.
that's what it yeah.
Perfect. So a nice prompt is as to make sure that you're saying all the things that you need to say and you're sort of getting ready ahead of time. Victor,
Yeah.
what would you add to that in terms of why do you think the tools are important?
If you're nonverbal,
Mm-hmm.
if you cannot talk,
Mm-hmm.
the tools help you better communicate with your doctor.
Right.
So let's say you only have a certain time with your doctor.
Mm-hmm.
You can fill out the tools before
Mm-hmm.
and and give it to your doctor, and your doctor will know how to treat you, whether or not you feel scared, what to best, how to deal with you when you feel scared. It's just a precaution to let people know how to like treat you during the visit. If you're nonverbal or you're super scared, the tool can help you like bridge the gap between you and the doctors better.
Mm-hmm. So helping the doctor be a little bit more prepared by doing some
And
preparation
be
on
a
your side,
little bit more understanding of your situation.
so the doctor can understand you a little bit better. I hear you. That's a really good point. Um, so my next question for you is, how do you use the tools, or maybe when do you use the tools?
When should you use the tools? It's before before the healthcare visit.
Before
So
the doctor visit, okay.
before you go to the doctor, you fill it out
Mm-hmm.
and then you turn it into the doctor, because doctors realistically don't have time to listen to you. It's just not realistic. They have other patients to see. So we can fill it out before and give it to your doctor, and your doctor can better assess you without the hassle of you trying to explain yourself, because the tool explains things in a way that you cannot remember. Say if you have a certain type of allergy and you forget it that day, but you wrote it down in the tools,
Mm-hmm.
it'll be better. It's a good memory. It's a good memory tool
It's a
for
good
you and the
memory.
doctor as well.
Right.
So
So,
my best assessment is you do it before the visit.
yeah, so you're advising to use the tool before the visit, and so that it helps the doctor because doctors are sort of, you're saying, short on time, so it helps to save everybody's time in that way because there's not a lot of time that you have during a visit. Really great point there. Erica, what would you want to add to how to use the tool or when do you use the tool?
Um, how to use the tool?
Mm-hmm.
I think, or how I use the tool is like I've said before, like I would use it as more of a prompt
Mm-hmm.
to what I need to say, and
Mm-hmm.
a lot of times what I'm saying doesn't come out too clearly,
Mm-hmm.
so having it written down, it works for me.
Mm-hmm.
What was the other question? Sorry.
So I guess it's like when do you use the tool, and you've sort of answered that is like you use it before the visit.
Oh yeah.
But you were saying that you use the tool because sometimes when you're nervous, I imagine like it's not easy to say certain things, and so having it written down helps, if I'm understanding that correctly.
Yes.
Okay, perfect. Um, so the next question then is what are the options, or how can you fill the tools out? Are there different ways that people can fill the tools out?
I'll
Erica, you
let
want to go first this time?
Erica. I'll let Erica go first.
Yeah,
Okay.
there are different ways of filling out the tools.
Mm-hmm.
Um, One, you can type it out if you get it online. But also, you can, if you have a worker, then your worker can fill it out for you. Um,
Mm-hmm.
you just need to give them the information. So,
Mm-hmm. So you're saying that the tools can be filled out online, so using a computer,
yeah,
and somebody can help you fill the tools out as well.
yes.
Okay, Victor, any other things you'd add there in terms of other ways people could be filling out the tools?
You could fill out the tools online or
Mm-hmm.
in person. Personally, I would do it online
Mm-hmm.
because it's way easier to keep
Mm-hmm.
track of everything, less
Mm-hmm.
less paperwork, and you can keep things organized online.
Mm-hmm.
So that's how I would do it.
Yeah, totally. So there's so you can print out the forms and fill them out in person, like you were saying, or you can fill them out online and have them saved, which is a really good point that like it might be easier to organize it if it's online. Perfect. So the next question for to you guys is how do the tools help you communicate with your doctor? And I know you've sort of touched on some of these points, but other things you want to add about how the tools help with communication specifically. Victor, do you want to go first this time?
Well, it helps you communicate. Say you have certain type of language
Mm-hmm.
that you don't use medical jargon. You
Mm-hmm.
could fill out the tool and that'll help you speak to your doctor better
Mm-hmm.
by understanding what your allergies are, how you can go about with your medication, and it just helps you get more comfortable with a doctor.
Mm-hmm.
And it helps the doctor best assess you in the
Mm-hmm.
process as well.
Right. So it gives the doctor more information that helps in the assessment, is what you're saying. Perfect.
Yes.
Erica.
Yeah. I think as well, like if you were to write it out, like pen and paper or whatever, and you couldn't think of the proper medical terms or whatever to use,
Mm-hmm.
I think that if you have a doctor that you've had for a long time, I'm pretty sure that they would understand what you're trying to say,
Mm-hmm.
um, because they know you
Mm-hmm.
um, as a person. But if you were going to meet like a new doctor, say like a psychiatrist,
Mm-hmm.
uh, they may not know you, but um, I think that before you go into the meeting, like if you have it written down um, in your way of explaining things, I think that the doctor will get to know you and will understand what you're trying to say. Um,
Mm-hmm.
so I know for me, when I was going to see my psychiatrist, um, I had written it down,
Yeah.
and I thought, oh, when I go see her, I'm going to, she'll probably understand what I'm saying because I've already um, written out all of my information, and all I needed to do was just give it to her, and all of my information was there. So,
Mm-hmm. Mm-hmm. Right. And that leads up actually really well into the next question I had was talking about your experiences, if you're comfortable sharing some of the experiences you've had with the tools and what that was like. So Erica, maybe you want to tell us a little bit more about that experience of like how it was showing or using the tools with at previous appointments?
yeah, it was kind of like a relief for
Mm-hmm.
me because I didn't really need to say anything. And
Mm-hmm.
if I'm going to meet a new doctor,
Mm-hmm.
I may get nervous of what I need to say.
Mm-hmm.
And like I've shared before, um, a lot of times my words don't come out too clearly. So I start to stutter,
Mm-hmm.
or I start to, what's the word I'm looking for? Um, Stumble over my words.
Right.
Um, so, like I say, with having the tools, it really, really helps out a lot because, um, like I say, you just hand it to them. They
Mm-hmm.
it over, and if they have any questions that they need to ask you, they can ask you. And,
Mm.
you know, um, you'll feel less nervous. I know I feel less nervous because
Right.
I don't have to tell my whole story because it's
Mm.
already written there.
Mm-hmm. So it helps you with that sense of nervousness because there's some communication that has already happened. There's some information that you've already shared, and you don't have to have that nervousness pressure when you're sharing that information.
Right.
Okay. Victor, anything you want to add there?
No, she
Okay,
said it all.
perfect. Okay. So those are the main questions that I had for our panelists. I want to take the opportunity to now ask our audience if you guys have any questions for us, please put them in the chat box. Um, and we can
So Irfan, we
answer
have
those
some
questions.
questions in the Q&A.
Okay, let me just pull up the Q&A panel then. Chiz, would you mind reading out the questions if that's okay?
So one question from Charlene is, I find it hard for me to go somewhere where I need help, and I find it hard to speak to someone when they go right in front of me during this pandemic as I don't have a family doctor. I keep having these issues during the pandemic as I have mental illnesses and autism.
Mm-hmm.
Getting help as I just went somewhere and I keep blowing up at people, and I find it makes me feel awful after it has happened.
Mm-hmm.
More of a comment, but maybe you can comment on Charlene's comment.
Right.
See, this is where the tools actually help. you not doing this blow up. So if you fill out the tools, right? If you fill out everything, helps what helps you calm down, what makes you blow up, like it helps the doctor say, okay, this is what helps me calm down, this is what blows me up. Like it helps communicate with your doctor more. It helps you give you and the doctor a safe space to talk
Mm-hmm.
and an open dialogue to talk.
Right. Okay. Yeah, I think that thanks for that, Victor. Yeah, like that's a really good point of like you can use the tools to help people understand your emotions because different people show their emotions in certain ways or how they're feeling. But yeah, it's really difficult that like yeah, when you don't have a family doctor and people keep coming right next to you, um, that doesn't sound like something easy. We are working on some different sort of handouts to help people because some people aren't really respecting sort of these physical distancing um, barriers or recommendations right now. And so we're working on different ways to help people understand this a little bit better. So I think there's another question that I can see is asking whether the forms are available in different languages. Um, to my knowledge, I think the forms are available in French as well on the website. And we're working on, I think so the forms are created in a partnership with Place, and they work on sort of the translation thing. So I think there are some other languages available on their website. Another question that's coming in is asking whether doctors are receptive to this type of form. So I'm going to let maybe one of you who's used the form before, how did the doctors, what is your experience of doctors reacting to this form? Have you had experiences with doctors reacting to this form? Victor or Erica, whoever.
I'll let my colleague Erica answer this.
Mm-hmm.
Okay. Yeah, no, I find that doctors are really receptive and they're really grateful for it.
Okay.
Because again, it's basically telling your whole story in one shot.
Right.
You know, it gives them that opportunity to understand who you are, what your needs are, and also if you don't feel comfortable going in by yourself, you can always have if you have a worker, you can have them come in as well. So that way, when the doctors do have questions to ask you, you can feel more comfortable because you'll have someone who feels who makes you feel safe.
Perfect.
Yeah.
And then Victor, do you want to share? I think so similarly to the fact that we're having this webinar to tell you guys about the tools. In the past, we've also had some events for doctors and sharing the tools with them. Victor, how have doctors reacted to the tools at that point? Like, I think you have some experiences you might want to share about how the doctors.
Yes. So this doctor said, oh, why would I need the tools, right? Why would I need the tools? But when you explained to him, he didn't want to listen. But from my point of view, from the patient's point of view, I explained it to him, and it really changed his perspective on what the tools actually mean, like what the tools actually are good for. They're good for people with disabilities who are scared of going to the doctors, or even people that are mute that are going to the doctors for the first time. They can write it down, they can go into the doctors, or if you have the benefit of going to a doctor virtually, now this pandemic is going on, you can actually send it to the doctor via email.
Right.
And that'll help the doctor better assess you.
Mm-hmm. And I think another good point that we should add is that sometimes doctors will say that they don't have enough time. So what you can do there is ask them to print out their notes for you, or just to repeat what they're saying, to make sure you're understanding, and record that information in the tools. So like we were saying, there's one tool where the second part is like the doctors may not want to fill that out, but you can ask for their notes, so that you have a record then of what happened at the healthcare visit. Okay. Other questions that I can see is, do you think the tools can be used in other parts of Canada? And I think the tools are quite broad. I think they could be used anywhere. There's nothing specific to being in Canada other than, like, I think, noting down your OHIP number. But I imagine that there's some sort of healthcare number or health insurance number that you would record in that place. But I think the tools, for the most part, are not really specific to Ontario. Most of the information is pretty broad, right? What do you guys think, Erica, Victor?
Yeah, I think so.
Right, the information in the tools is fairly broad.
Yeah.
And yeah, a copy of the tools will be sending out the copies, the PDF links for the tools at the end of this session. We'll be emailing all of you with a copy of the tools, so you guys will have those links and be able to access the tools. If you need print copies, we can try and arrange that as well. It's a little bit difficult more right now because with everybody working from home. But if you feel like you need print copies, feel free to email us. Our email is hcard, HCARDD @camh.ca, and we can help you out in terms of accessing the tools if you're having any trouble. Okay, another person asking a question has said that they feel rushed when I feel rushed when I'm at my doctor's appointment and judged about my addiction. And when I go to the doctor, she forgets what I'm in the office for. What do I do?
This is a great question.
Uh-huh.
So the tools are there to help you stay focused
Right,
and on task, right?
right.
They're here to help you with what you need to do. Get in and get out with minimal stress to
Mm-hmm.
you and the doctor.
Mm-hmm.
So if you ever have stress about timing, you can fill out the tool beforehand,
Mm-hmm.
maybe a week, maybe a month before you go to the doctor, and then you'll have a certain type of safety net so you can like go to the doctor with confidence and say, here you go. Here's my information.
Mm-hmm.
Here's what helps me calm down, and here's
Right,
what helps me, and here's what stresses me out.
right.
Here are my medications, what medications I take.
Mm-hmm.
And it's just a simpler form of a medical alert bracelet.
Yeah, it's like a medical alert bracelet to communicate. And some great points you bring up that, Victor, that I want to sort of echo and highlight is that the situation in this question about feeling rushed, this is a great place that you can use the tools to sort of communicate those things ahead of time. So writing some stuff down and sending that to the doctor ahead of time to focus the visit and make sure that the visit is about what you need the visit for, because this is your healthcare visit, right? So focusing the visit. Great point there, Victor. Erica, anything you want to add to that point?
No, I think
You're good. Perfect. Okay. Any other questions that we have from our attendees? And maybe Tiz can help us.
I don't see any questions right now, but I'm going to give people a minute to think about
Sure.
what they might want to ask. Also, has anybody maybe gone to a virtual doctor's visit? Do they have any questions about seeing a doctor virtually?
Yeah. Is that something
Catch COVID virtually. That's my point.
Yeah, that's a good point, is that you can't catch COVID virtually. That's why I think doctors are having virtual visits. And part of an effort to stop the infection spreading, as much as possible, if you can be seen virtually. I know a lot of mental health visits have moved to a virtual format, where you can have a dialogue and a communication with your worker, your doctor, different types of areas of healthcare. It's moved to a virtual setting because it takes away that face-to-face interaction that does potentially increase your chance of contracting or getting COVID. So good point there, Victor.
And it speeds up traffic.
It speeds up traffic, yes. That's a side benefit to virtual visits. Have you guys had experience with virtual visits that you want to talk about? And again, you don't have to if you don't want to.
Victor, you want to go?
Ladies first.
Yeah, I had some virtual visits
Yeah.
with a few of my mental health team.
Right.
Because I'm going into a new program for my mental health.
Yeah.
So I had to obviously do a virtual visit with the therapist. And it was weird, but it was okay. And I think
different, right, from what you're used to.
I think what was weird about it was just the fact that obviously I can't go in. Right? And so it was weird in that way.
No, that's fair. Victor, anything else to add?
No, she said practically everything.
Okay, she spoke about her experiences of virtual visits, which is great. Okay. So I'm just going to switch. If we're not having any other questions, just at this moment.
We have one comment from
We have a comment. Yep.
Talking about trust when doing a virtual visit. So maybe, is that related to privacy concerns?
I'll let the doctor answer this.
Yeah, no, I think that there's that's definitely a valid concern for sure about things being private. And that's why different doctors will be using different types of technology. So they're not all going to use maybe Zoom, because I think Zoom may be less private. They might be using different versions of software. For example, our hospital, CAMH, uses WebEx, because WebEx is more secure and more private than Zoom. So different doctors will be using different technologies to do virtual visits, just because that makes it more private and more secure. And just like your regular doctor visits, where everything that you say is between you and your doctor, the same thing applies when you're having your virtual visits. So be sure to sort of, if you are worried about those things, definitely have a conversation with your doctor about things like privacy. I think we have another comment talking about telephone appointments. So yeah, we do know that virtual visits may not always work all the time and for everybody. So telephone appointments are becoming a little bit more regular right now. People are having phone check-ins. Okay. I think there's another question coming through that's asking what happens if you go in person to the doctor. So there are some reasons which will still need you to go to the doctor in person. Sometimes if it's an emergency, you need to go to the emergency room, that has to happen in person. And if you want to go to your doctor in person, I think it depends on why you're going to see them. So that's a good reason to call your doctor ahead of time and say, this is what's happening. And then you'd have a discussion about, does this need to be an online visit or does this need to be an in-person visit? Because depending on the type of issue that you're having, sometimes certain issues need to be addressed in person. Others, they can be done online. So it's good to call ahead and figure out with your doctor what is the best next step in terms of having an online visit versus an in-person visit. So there's definitely certain certain types of complaints that people will have, or certain types of health issues that need to be in person. And that's a conversation that you would have with your doctor to figure that out. Okay. Other questions or comments? Anything you guys want to add about asking to see doctors in person?
No, I'm good.
You're good, Erica?
Yeah, I'm good.
Okay. So then I have a few last couple of slides that I want to share with people. So the third tool that I mentioned a little bit earlier is called the COVID-19 Hospital Transfer Form for patients with intellectual and developmental disabilities. So this is a tool that we've developed fairly recently in the last 2 months or so. And this is a tool that has a lot of the features from the previous tools, but the big change in this one is that there's an alerts box that you can use to highlight specific important information that is very relevant. And this tool is mainly for people who are being admitted to hospital right now, where we know that there's not a lot of visitors being allowed in with you to go to the hospital. So this is a way to sort of convey some of that information that those visitors would help normally do. That being said, I think the policy around having visitors or having a support person have been changing a lot, and we now know that a lot of people need their support people with them to be able to ensure that they're in the best health positions. And yeah, so people are being allowed into hospitals, but I think it's a very case by case basis. Okay, so those were our conversations about all the different tools. Again, I now invite, if there's still any more questions, I invite you guys to ask them now. Victor and Erica, any other comments you want to add? Sort of closing comments or?
No, I'm good.
Thank you for your patience with us.
Thank you for your patience with us. Great comment. So yeah, we're a part of a team called HCARD, which is a research partnership. Feel free to follow us on our social media. We're on Instagram, Twitter, Facebook. We have a website and a YouTube page as well, and we'll be sending links to the tools, as well as YouTube videos as well. To all of you, if you need to get in touch with us, our email address is hcard@camh.ca. You can even phone us, and we'd be happy to assist you guys further. Tiz, any other questions coming in?
I don't have questions, but I have Elizabeth saying that this was really helpful. Thank you, everyone. Much appreciated. And
Perfect.
great job, Victor and Erica from Linda. Thank you very much for those reassuring comments. We appreciate them.
For sure. Thank you so much, guys. And thank you for listening to us today.
Nancy, too, thank you. Very helpful resources. And a reminder, I'll be sending an email to everybody that signed up today.
Perfect. So thank you for joining us today. It's about 2:48, so we finished a little bit early. So that gives you, all of our attendees, some extra time to go about and do something free with their extra free 10 minutes. But thank you for joining us today.
Should we put on music?
Sorry?
Should we put on music?
I just had a couple of more comments, Victor. So thank you for joining us all today. Yeah, feel free to contact us and we'll be sending some information your way. Thanks for joining us on this webinar and hope you have a great day. Stay safe and be well. Thank you.
Thank you.